Hello everyone, I am Dr. Adeeb Mohammed Hussain, Specialist Internal Medicine, working in NMC Medical Center, Buhairah, Corniche, with an experience of more than 10 years. My expertise is diabetes, hypertension and hypothyroid. My special interest is diabetes in gestation and diabetes emergencies. Today we are going to discuss a very important topic, that is Ramadan and fasting. Most of the people who want to fast and they are diabetic will have very common questions. Okay, what to do in Ramadan. So these common questions will be answered by me today in this video. The most important question during the month of Ramadan is, can diabetic patients fast in the month of Ramadan? The answer is very simple. The answer is yes. You can fast in Ramadan provided you have a balanced and well controlled diabetes in the last 1 or 2 years. If you have any changes in the last 1 or 2 years in managing your diabetes, or any event has occurred in the last 1 year where your diabetes has been not in control or your sugars are erratically high or erratically low, in that situation we would suggest not to go in for fasting without consulting your physician. If your sugars are well under control, there is no need to leave the fast. You can easily have a long hour of fasting provided you manage your diabetes based on your physician. The management of diabetes in the month of Ramadan relies mainly on your treating physician, the physician who is seeing you from years together, because diabetic is not a condition which arises immediately. A lot of the patients have a long duration or a long event of diabetes considering at least 5 to 10 years. These patients are more worried in the month of Ramadan. So to have a proper management plan, I would suggest to consult your physician a month before the starting of Ramadan, so that he will cater you a complete diet chart and a complete change in your medication, and he would suggest you how to manage diabetes very efficiently for 1 full month. As a physician, I would always suggest not to change your medication or not to alter your medication in the month of Ramadan, because in the month of Ramadan the fasting duration is very long. So you have to consult your physician before you change or alter your medication, because the physician knows when to give the medication and when to stop the medication. In such situation, when the fasting hours are too long, to prevent from an event of hypoglycemia or hyperglycemia, yani ke to prevent the event of high glucose levels or low glucose levels, you need to consult your physician before you change your medication. So I would advise not to change the medication or alter the medication on your own. Consult your physician so that he will help you in changing or altering the medicine and the time of taking the medicine. He would help you in doing this. The most important thing to manage in Ramadan for diabetic patients is the diet. What happens is, most of the patients go in for a very high caloric diet or high sugary diet thinking that they are fasting for more than 12 hours, 14 hours. So what I would suggest is to have a balanced diet even in the seher and the iftar. Seher is the pre-dawn meal where you take it in the morning. I would suggest to have a diet which is high in proteins. The rich source of protein, what I would suggest for a diabetic would be seafood. The second thing is to use lot of dairy products because they act as natural probiotics. And the third thing is to avoid simple carbohydrates and go in for complex carbohydrates, as they will help you to keep you full for the whole day. They would provide you the complete energy required for the long fasting hours. Avoid sugary drinks, avoid packaged drinks, avoid tea and coffee in the early morning meal, what is called as sahur, because tea and coffee contains lot of caffeine which leads to dehydration because of excessive urination, so that you may feel tired the whole day. And in the iftar, that is the second meal which is done after the dawn, so I would suggest is not to go in for very high caloric diet such as like fried items or sugary drinks, because they again build up a lot of sugar and your sugar may shoot up. So avoid oily food, avoid spicy food and avoid packaged drinking juices which contain high in sugar. So I would suggest to have a balanced diet to have a healthy Ramadan. Most of the times people who are on insulin try to go in for fasting. I would suggest people who are on insulin for a very long time and who have erratic blood glucose levels, in case your sugars are going up erratically or your sugars are coming down erratically, these patients I would always suggest not to go in for fasting, because insulin requirement is 3 times in a day or 2 times in a day. To balance the insulin requirement and your diet, I would strongly suggest that people who have uncontrolled sugars or erratic change in the diabetic pattern, I would strongly suggest to not to go in for fasting. In spite of these things, if you want to fast, I would suggest to consult your physician and then go in for fasting. Patients with diabetes should always be cautious with low sugars, because symptoms of high sugar don't come up so easily, but the symptoms of low sugars do come evidently. And when these type of symptoms come in, I would strongly suggest to break the fast. Among them, the important symptoms what commonly we see in diabetic patients is excessive sweating, tremors, breathlessness, and sometimes even syncopal attack. Syncopal attack means loss of consciousness. When these type of situations arise, I would strongly suggest to break the fast and take some sweet to prevent the event of hypoglycemia, because hypoglycemia is a very dangerous condition where your brain may get damaged. So patients with diabetes should always be cautious with the event of hypoglycemia. So I would strongly suggest, when these type of symptoms are seen by your bystanders, I would strongly suggest to break your fast. The take home message with this video is, if you are a diabetic, I would strongly suggest to consult your physician before changing the medicines or altering the medicines on your own, which would be very dangerous. And those people who can fast for such long durations with medications should fast, and those who cannot fast, I would strongly recommend to not fast for long durations. If you are healthy enough and you have a very good control in your sugars for the last 1 year, or fast, there is no problem. So I wish Ramzan Kareem once again, and if you have any queries regarding diabetes in Ramadan, you can consult me. I am Dr. Adeeb, Mohammed, NMC Medical Center, Buhairah, Corniche, Sharjah.